as we speak right now, a technical advisory committee comprising of Ministry of Health representative, but also private sector stakeholders and various incubations centers across the country. We would run more in details specific briefing on this activity. I will mention it just in a while. But the whole program will be concluded by a physical activity, a delegation of selected companies, solution providers by September this year. So why, if we move to the next slide, Nicker, why you should join this challenge? I mean, by this challenge, we are enabling you to get fast-track paths to public and private healthcare sector accelerator programs in the country, access to the global innovation network for knowledge sharing and expand beyond borders. Here we are collaborating with well-established innovation hubs. An example, AstraZeneca Healthcare Innovation Hub. We are also having a possibility and dialogue with the local stakeholders that enables to demonstrate the products, run the various product solution trials and proof of concept. That is very important to, as far as you are already implementing your solutions across the world, in Nordics, in Europe, in America, it will be important to also test them in the local context. We, through this program, enable you the access to those sandboxes. All those above mentioned features and let's say benefits also enable access you to the right experts on the market for mentorship, product adjustment, product development, and not last but not least, also access to the funding in order to further develop your product adapted on the market. So collaborating very closely with the local stakeholders. I will run or held a specific dedicated session, a briefing session. If you move to the next slide, Nicker, on 24th of May. I will be happy to share the invitation for this separately after this session here to all of you participating, for you to consider and to tune in and to see if this particular innovation challenge would be of interest to you. So it will be held. Please mark the calendar on 24th of May, 9 to 10 preliminarily, and we will send some more information about that and hope to see some of you also participating to learn more about this particular program, as we will also have a representative from Ministry of Health sharing the non-communicable disease landscape in Malaysia. So I hope to see a few of you, or maybe all of you, on this session and see how we can collaborate jointly. So thank you, Nicker. That was a few words from my side.
Thank you, Ashwa. Yeah, okay, let me move on. My apology, I think I did not introduce myself at the early stage for me to caught up with the system here. My name is Nicker. I'm with Innovation Norway Singapore office. And prior to joining Innovation Norway, I was in the healthcare industry. Basically, I worked with hospitals for the past 15 over years. So I'm pretty familiar with their operation and also their needs. So I think it's quite appropriate that I actually host the Singapore program. And the topic that I picked to focus on is actually the amplified nurse. Let me go through what does this program means. Okay. So basically the focus is actually like what the title says, on the nurses. This program will investigate solution and system to help our nurses in their work. We understand that they are actually very tied down with a lot of administrative and non-value added work through the years. And this has been escalated due to the pandemic. As you can imagine, now the nurses has a lot more extra tasks in order to ensure patient safety due to the pandemic. So here we are do you have a solution that can help improve nurses in their productivity to augment their nursing manpower or their skill set, or reduce their nursing manual work, or automate the administrative tasks, or anything that can help the nurses do their work better? If yes, then this is the program for you, right? So let me go through briefly about the partners that we have, which I mentioned earlier in the session. It's important because these partners are the targeted audience. So these are the people that will be listening in when you do your pitching, if you are shortlisted for this program. And then this will be also the key decision makers that is coming in to assess, select, and eventually pilots, demos, or even tenders and projects will be coming in future. So a bit of Singapore healthcare system, basically what I mentioned earlier, it comprises of what we call a healthcare clusters. This is equivalent to, in Norway, the so-called the regional health. In Sweden and in Finland, I believe they have the equivalent. So basically in Singapore, the country is divided into West, Central, and East. So the West, we have NUHS, and the Central, we have NHG, and in the East, we have Sing Health. So if you look at this table here, so what does they comprise? So each cluster is actually pretty comprehensive in the sense that they have acute hospital, they have community hospital, they have primary care, they have specialty center, and also medical school as well. So each cluster is complete with this stream of service, which will actually tie in to support the population in their region. So the partners that we have is actually with the group nursing of each clusters. So you can imagine that once we reach out to the group nursing, we actually reach out to all the nursing within the Singapore public healthcare. That means from the group nursing, that means in each hospital, they will have their chief nurse and of course there are all the other nursing team. So the information from the group nursing will be disseminated down to the hospital level, as well as to the community hospital and the primary care, and subsequently the rest as well. So we are partnering with them to help us to reach out to all the nurses in the various teams, in the various departments within the healthcare system. So the next partner I want to introduce is CHART, Center for Healthcare Assistive and Robotics Technology. So this is established by the Ministry of Health in Singapore and together with EDB. So their focus is to enable the healthcare professionals to work closely with the industry, the academia, and research institute to co-develop and test innovative so-called technology in Singapore. So CHART is also one of the key agencies that is identified to coordinate and support the end-to-end development of robotics technology as well as other innovative technology. So there are many projects where CHART actually manage and then roll out in the various hospitals across the 3 clusters. So they also have a test lab which enabled vendors or suppliers to bring in their products for demonstration, and that's where they'll invite the various hospitals nursing team to come in to look at the demonstration, and also if it's been identified as a solution that is widely sought after, they will then work on some budgeting, some funding from the Ministry of Health in order to implement the solution across the different hospitals. Lastly will be the Integrated Healthcare Information System, or short form for ITIS. This is the IT agency for Singapore Public Health. So they play the role of implementing all the various IT system solutions within Singapore. Singapore have actually been quite intensive in terms of centralizing and integrating the various IT system in Singapore. So all the 3 cluster IT system are quite integrated. In fact, there's a lot of standardization being done in the past few years. We have more or less standardized the EMR, electronic medical records, in the hospitals. So all the hospitals are using quite similar EMR now, and on top of that, plus on top of that, with all other IT systems as well, be it the HR, be it the training systems, or be it some of the medical systems. So IT play a big role in terms of the IT security management of the various equipment as well as systems within the healthcare industry in Singapore. So to run through the program overview, like what I mentioned earlier, so today you are attending the program introduction webinar. There's 2 of them, so you're attending on the 20th. So by today, I hope that you'll get a clear picture of what is program about and assess whether it is suitable for your company. And then there will be a registration form, which I'll go through in details later, where you can submit to your respective TPO office. And from there, we will then do the shortlisting of the company for the virtual presentation program, which is the second phase. So the virtual presentation program will start on the 13th of May, which will be the presentation by the healthcare provider, which is the partners which I listed just now, and then followed by the virtual presentation by the Nordic companies in June. Okay. Thirdly, lastly, will be the physical visit. For those who went through the virtual presentation program and have been shortlisted by the hospitals as key technology that they are interested to proceed further, we will then invite you for a physical visit to Singapore. So there will be a fee of 20,000 kroners imposed on this. So what you get is that you get to visit the Singapore site and meet up with the decision makers. So you get opportunity to network and connect with key users and decision makers, and of course to present your solution to the hospitals, to the clusters, or even to the national level. So you'll get market intelligence, create brand awareness, and as well as form partnership. So this is a graphical representation of the program. So this is where we are today. And like what I mentioned, next will be on the 6th of May. We will hope to receive your registration. Okay, of course, between now to 6th of May, you can submit anytime, but the closing date will be the 6th of May. And then the virtual program presentation will start on the 13th of May, which is a presentation by the healthcare providers. I understand some of you might be attending the Nordic Japan program, which ends on the 13th of May. So if any of you or if many of you find that there's a clash between these two programs, do let me know, and then we will decide whether there is a need to shift this date. But as of now, we will still keep it to this date until we hear from you guys. Okay. And then following that, once you have heard from the healthcare provider and fully understand their needs, although today I'll be going through briefly, but I think what we want to hear is from the nurses themselves, what are their needs, and that's where you can actually ask some questions to clarify further. From there, you can then prepare your presentation. So in your presentation preparation, we will come in to help you because we will want you to be very focused on your presentation to the healthcare providers. We will provide guidance and coaching and review your slides so that you can actually present in a more effective manner. So we will then start the presentation between the 6th to 17th. Every day we will actually have about 3 companies doing the presentation. Each will be given about 45 minutes. And so one day we can only have 3. And then what we'll do is that we will actually have a schedule of the list of companies presenting to the care providers, and they will then decide based on the schedule and based on the information you provided whether they will want to attend, because there are so many nurses in the industry. So it's open up to all the nurses to log in to listen to the pitching from the companies. So they will select which one is of interest to them. But if they miss it due to their tight schedule or due to their duty, we will have recorded presentation of your presentation, and then we'll provide them the link where they can go in to listen. The only difference is that they will not be able to ask questions directly to you, but they can post to us via email where we can follow up. So after this presentation by the companies, then we will go back to the healthcare providers again to ask them which are the companies or technology they find that they want to really move on to the next stage, and that means you are probably successful in getting their interest. That means they likely will want to go into some pilots or whatever, and that's where I think a much closer collaboration and partnership is required. And then you might want to decide whether you want to come to Singapore for a physical market visit where you can meet the various hospitals and visit the various sites and the wards or the wherever department in the hospitals where your solution will be implemented to get a good understanding of the market situation. And so the shortlisting will be on the 24th of June, and then we will have probably a kind of break because I think Nordic countries will have their break from June to August, and then when we'll use that time to plan for the travel, which we'll hope to target to have that visit sometime in the first week of September. So this is just the indicative. We will actually assess the situation along when we are closer to the date. So now I'd like to go through the details of the focus area. This is very important. And the information we gather from is from the Smart Nursing Walk program, which was run by CHART. And also we have also gathered the cluster group nursing inputs regarding their problem statement. In fact, I just got the complete problem statement from the nursing group this morning. So this is really fresh from the oven. This is very important for you to understand what they are looking for, because this will increase your chance of being selected by them. And also this will also help you very much in preparing your presentation so that you can be very targeted to get their attention. So the focus is how can we help our nurses? So like what I mentioned earlier, this Smart Nursing Ward program is actually run by CHART. Unfortunately, has ended. So this program is not valid anymore. It started in 2018. But nevertheless, this is a very good program that was run. It was very successful. And we are using this one as a reference, basically because the problem statement that was being identified here, which is 5 key focus areas, is still applicable. So they are still looking into those problems that they have been looking at since 2018. Some have been resolved, but not all has been resolved. And this is where the funding was actually to provide the hospitals and the centers with a focus on helping nurses in their productivity improvement, right? And so with this funding, although it has ended, there are new fresh funding coming up. And again, nurses is always the focus for the Ministry of Health because there is a huge shortage of nurses, and the job of the nurses are becoming more and more demanding through the years, right? So, but as to the details of the funding, that one I'll leave it to IHIS, which they will share in more details on the webinar for sharing by the healthcare provider. So just a bit of insight into this program criteria so that you can understand better potentially what could the new funding be like, right? In this case, this funding was from the Ministry of Health was given to 20 healthcare facilities, which comprise of those facilities that I have listed in the table earlier when I described the 3 clusters. And the funding principle is to fund up to 70% from Ministry of Health, and then the balance 30% will be actually so-called funded by the hospital themselves. So you can see in that case, it becomes very attractive for the hospitals to engage or to so-called come into this program because they are only paying 30% of the whole project cost, right? And the KPI is very simple for this program. It's only just to achieve 10% of nursing productivity. So in this case, when you understand this better, you can better understand why later in the application form or the registration form for this program, I have actually put in all this as part of the guideline as well. So with this, then you can imagine the nurses will be more confident in selecting your solution. So these numbers are pretty important to present in your registration form. So of course, there are other KPIs other than productivity. That means generally improving of patient safety, improving of the staff morale, patient experience, and of course, clinical productivity. So let's go into the details of the problem statement. So like what I mentioned earlier, there are 5 key areas under the Smart Nursing Walk program, which are still applicable. So that's listed on the table there. And then the next will be another 10, or could be more. I could be getting more problem statement from the nursing group. So this cluster nursing group nursing has actually come back to me on additional 10 problem statement that they have identified. Okay, so I'll go through in more details through this slide here. So the first one, which is one of the 5 focus area presented under the Smart Nursing Walk program, is end-to-end logistic management of supplies and equipment. Basically, this is focusing on improving the materials tracking and delivery. That means you can imagine in the hospital, there are a lot of material, be it equipment or be it consumable that the nurses got to use every day. So it is quite a challenge for them to track or to deliver, that means to receive or to store all these items. And also, so you can use auto.
Sorry, this is Nicholas from Business Sweden. I just want to check, right? Your recording seems to have stopped based on the meeting check. So just in case, just check it. Wait a second. Yeah.
I think it's still ongoing. I actually do
It's still
a
ongoing?
recording on my end as well.
Okay, just in case, yeah.
Yeah, good reminder. My side still running.
Okay.
Actually, I started late also just now. Hey, thanks for watching out for the chat. Sorry guys, sometimes I just go through and I forgot to look at the chat message. So maybe the other people office can help me to monitor as well. Okay, let me carry on. So I was on this logistic management supply system. So I was talking about the robot. So you can imagine for nurses to retrieve items from the store is also another challenge. So they are also looking into having robots to deliver this item, be in the ward or be in the operating theater or any of the healthcare facilities. So material tracking requires a lot of effort for the nurses to make sure there's enough stock. You can imagine sometimes they're so busy, and if the material department did not stock up the items, then they could end up not having certain consumables or equipment to use when the patient need it. So it's important for them to be well aware of the par level or the stock level of the items. So they and having robots to move in different area, be patient area, and having the ability to pick and place items. I think these are all many of the interesting technology that they are looking at. Okay. Next, quite a big topic, patient monitoring system. But generally, this is focusing on the needs to monitor patient constantly. You can imagine the nurses how much time they spend to make their rounds to collect or to record the vital signs of the patients. So this is very challenging for them. So they are looking into automated way. And of course, with the pandemic and all the more contactless way of monitoring has become one of the very well sought after way of monitoring patient. But nevertheless, we still are quite focused into using wearable as well, because wearables could be something that's more likely possible now with some limitation of technology. So in any kind of area of vital sign monitoring of patient or even behavioral monitoring of patient, these are the key areas that they are looking at. So this will definitely save a lot of the nursing time, and then they can actually focus on more priority area. That means because such solution will detect anomalies and also trigger alerts to inform the nurses of which patient needed attention the most. The third one is actually application to patient and caregivers. So this is quite focused on application, which is likely to be mobile apps or web-based apps, targeting on empowering patients and caregivers to self-manage or to take care of their loved one better, right? So this will include systems which are able to monitor the symptom through different kinds of sensors, to coordinate with the nurses, and also to keep track of appointments or medication adherence, or how to effectively take care of themselves, be in a hospital or especially when they're discharged and they're back home. Without the nurses, how can they follow through on their care, continue their care at home? Next is the assisting oral medication delivery and administration, right? So patient, when they're in the hospital, they are well taken care of the nurses, timely, they'll get their medication because the nurses will be there to make sure that they take their medication. But what happens when they go home? So medication adherence has always been a problem and is still a problem. So how can we have solution to remind patient, to check on patient, to monitor, or even to get feedback on any kind of side effect from any kind of treatment or medication, so that they can, the clinicians or the nurses can follow through better. So empowering the patient to be able to move from hospital to home with still being able to have proper medication adherence is very important. The fifth one from the so-called the nursing smart nursing program is actually the real-time integrated system. So we have been talking about a lot of digitalization, and you can imagine the amount of data that's being generated. And of course, with more and more use of technology in the hospital, you can imagine there's a lot more alerts, a lot more reminders or any kind of things that require the nurse's attention. So you can imagine the noise, the confusion within the ward over time, because more and more data are collected, but it can become a alarm fatigue, and it can become very confusing for the nurses. So this real-time integrated system will actually help to integrate all these various information to allow the nurse to prioritize and be alerted accordingly, again, to focus their attention on patients that require more immediate attention, right? So this is more on data analytics as well as sensors and so-called various alert system. How do you reach out to the right nurse at the right time? If the nurses are not able to respond, how does the system escalate accordingly to the next person that is available? Okay, now I'm moving on to the 10 new problem statement that was identified by the group nursing. First is the last mile robotics and soft robotics. When we talk about last mile in a hospital, we are talking about that portion between the store to the patient bedside. So for example, if the patient need a simple thing like a diaper, right? Do the nurse need to go all the way to the store to pick it up and then bring it to the patient bedside? Hopefully they can see that this task can be taken over by a robot, where they can retrieve items from the store and then bring it to the patient bedside. And ideally, of course, also to record that this item has been used by the patient so that he can be charged accordingly when they discharge. When we come to soft robotics, what do I soft robotics? So this is the way that the nurses understand soft robotics to ensure or to facilitate nursing care. So robots that help nurses in delivering care to the patient, items that has direct contact and direct interaction with the patient. So it could be something to do with the bed, where there is direct contact. That means maybe a turning of the bed, or some automated sensors on the bed to monitor the patient, or to sense for patient unusual behavior, or all the such, or even some simple things like rehab systems to help the patient to recover better using robotics. Smart dressing. So these are looking at dressing, not the traditional dressing, but dressing with some smart technology. It could be some sensors so that you can actually monitor the wound condition and analyze it, and then send out alert when there is a need for any intervention, right? And you can imagine why the nurses wanted this, because they are probably spending a lot of time trying to so-called monitor the wound. And you can imagine with the dressing over the wound, it's quite difficult to see what's happening under the dressing, right? So having something to sense it is actually will be more effective, rather than then having to remove the wound every time and then use the visually to observe the wound itself, right? And of course, when patient discharge, or even when they discharge back to home, how can the patient continue to use such dressing? It could be something that is very innovative to help them manage it themselves without any kind of professional skills required to put on the dressing. Closed loop tele and remote care system. So tele and remote care system are quite popular and mentioned many times in the industry. But unfortunately, the nurses are seeing that many of them are one way, and it doesn't provide that closed loop. So when they talk about closed loop, they like the system to really feedback information or even to retrieve information from the healthcare system so they can better manage, and also that can also reduce the updating of such information back into the hospital system as required. And also some AI to help the nurses in scheduling and prioritizing the follow-up for the remote or telecare. Next is intelligent sensing. Also, here what they are looking at. Okay, so this is the structure that I've actually given them the template, and they have actually used this. So generally in the hospital, what we do normally for project is we will always identify what is the as is. That means presently, how is the situation, and what is the to be, the ideal future that they hope to see. So presently, you can see that this is what's happening now, and in future, what they want is to have sensors again. So this is actually all in line with Healthcare 4.0, where a lot of sensors and data collection are being used to detect early warning system and using predictive analysis to understand and how they can, especially in a home-based smart nursing smart sensing, where we can imagine that we want to discharge patient earlier, but we are still concerned about whether they are doing well at home. So is there a system that use environmental sensors when patient is at home to monitor their progress when they're back home? And empowering patients to, again, of course, to be able to take care of themselves better. So here are two very examples that they have actually identified. Things like NGT, also gastric tube, where they will need to insert for some of the patients, even though they are discharged. That means how can we monitor that the so-called there isn't any infection, or the tube are being still secure in that sense, or any kind of catheter that is being used even when they are discharged, whether these are again have any kind of complication due to the use of catheter in various kind of care delivery. So of course, sometimes it's not just the patient, but the caregiver or the family are also involved and trained to help to monitor as well. Decision making in real time. So nurses are struggling with a lot, which I shared earlier. So they would like to have something to really help them in making decision real time. That means, again, although we have a lot of sensors, but with all these sensors coming in and with the various patient condition, as well as the various different priority required, are the nurses able to get this information and know how to respond? And then when they are doing their duty, sometimes or even when they are trying to record patient condition, many times they actually spend a lot of time doing documentation. So things like speech to text documentation are really useful for them to reduce their time spent in doing administrative work, right? So we can see here also wearables, hands-free communication, where they can use when they are doing their walk rounds anytime, anywhere. And using AR documentation, where we help them to review the notes, because you can imagine the amount of patient notes that they go through. Is there a augmented reality way of screening through the notes and then filtering out the important information for them? I think this one not only just apply for the nurses, but for the doctors as well. Liberating the nurses for job redesign. This is based on a lot of job. In fact, not really value-added work are being added onto the nurses. So can we actually automate all this work and help them to really focus their work into more value-added tasks? So simple things like bed turning, turning devices for bed, although it has been a problem all these years, it is still an unresolved problem, right? So this is still a problem there. Self-medication, automatic dispenser at the bedside. That means the nurses can reduce their so-called time spent in medication round for selected patients who are more able. That means can we have a automatic dispenser at their bedside where they can self-manage their medication taking. E-learning to help them pick up new skills or to help them manage, so-called ensure best practices are being carried out because nurses turnaround is or turnover is very high. So and they need to make sure that the level of expertise are maintained. So other kind of nursing productivity as well. So again, you can see, again, they have brought this issue of regular turning of patient as one of the high focus area as well. So because turning of patient is very manual intensive and it's also quite so-called quite challenging for nurses, especially in Singapore, where we have many nurses from the Asia country, which are smaller in size, and some patients are pretty huge. So bed turning has always been a problem. And with the big sound problem, it actually creates a lot more challenges in taking care of patients, and it lengthened their stay within the hospital. Transporting patient from one location to another location, again, I think it's again due to the Asian size. The beds are pretty heavy for us to really push them around. So they are looking into automated bed or wheelchair, which can be programmed to transport the patient. But of course, some people will challenge that as to the safety issue. So although this one are automated, there must be added safety issue to ensure patients are actually being transported in a safe manner. Or maybe to start off with, maybe reduce the number of manpowers required to transport such patient. Generally, for pushing a patient from one point to another point using the hospital beds, they require at least 2 staff to follow, 1 clinical staff and 1 non-clinical staff. So, but if we can reduce to 1 staff, of course, that is definitely a saving in manpower here. So again, this is a bit related to the logistic issue, looking at how do we actually ensure the stock level are healthy, and also to automate the topping up. So this is actually on one hand monitoring the par level, on the other hand also to automate the topping up of the item. So when you talk about clean utility, this is actually a store area within every ward, and this is where they store all their consumable as well as some of their medical equipment. So you can understand how is a space where it has many hundreds of items, and it's quite challenging for them to really monitor the par level. Okay, maybe I should take a short break here and to hear any questions before I move on to the last segment of how can we sign up for this program. Any questions from the floor? No? Okay, I'll move on then. So these are 2 of the project pathways. That means 2 of the possibility how the potential project could come around. Firstly is of course through some funding through MOH or from the hospitals. So even though the Smart Nursing Work funding has ended, there is a new funding called the MOH Health Innovation Fund. So these are targeted for ready solution with limited customization, if any. So these are products which are available in the market or have been kind of cleared for FDA or CE and ready to be sold in the market. So such could be going through proof of value and then through scaling up to various hospitals. And then lastly, can move on to a cluster level. That means if we are moving on to a cluster level, you're likely targeting for a national level kind of implementation, right? So this is where the past experience from chart, that's what they do. They identify solution going through a proof of value, and then they scale in 1 or 2 hospitals. And once it's proven, then they actually offer up to the whole cluster or nationally for them to identify whether they are keen to adopt that kind of solution. Yes, I have a question from Health Fox. Yes.
Yes, thank you, sir. regarding the proof of value and the scale up, so what kind of funding and investment capabilities the locals for that?
So generally, I don't have the exact numbers here, but this will be shared on the webinar from the care provider. In this case, likely will be shared by IHIS. IHIS do have some information on the funding. I can't disclose too much at this point, but when you talk about how much, generally we do not really have a fixed figure because it depends on the solution that is provided, right? So in this case, what we are trying to say here that the new way of funding from MOH is that they are not looking at a hospital level, they are looking at a cluster level at least or a national level. That means whatever solution that's being identified under this program now, if we go for this funding, it needs to be a solution that the cluster level have shown interest. Okay, so if that has been, that means whatever you submit, if eventually you get to come to Singapore, likely you are close to a cluster level. That means most of the hospital are interested in your solution. And then we can talk about how do we execute a proof of value. And that's where the funding will come in to support the cost to do a proof of value, and likely to be in a ward or sometime in a single hospital. Then moving up to scale up, that means to standardize and centralize. That means at least a few hospitals or at least one cluster will be involved to implement the solution. And then eventually it will be then going up to the national level. So all this funding, depending on the project. So if you are talking about a very high-end system, of course, it can go into millions of dollars. But you are talking about simple system like even a pill crusher, right? A pill crusher, this is a real case where I have actually been involved in one of the pill crusher project. So those are probably 1,000 to 2,000 per system. So, but it's in high volume. Every ward will have one or a few of the pill crusher. So that is a kind of so-called budget that will be allocated according to the solution. I hope I answered that. Okay. So the next pathway is actually what we call a CFC, call for collaboration. So these are for systems which there isn't really a best fit as of today, or system where they require major customization. So in that case, then this will go through a special route, what we call call for collaboration, where the clusters will then partner with the solution provider, and there will be sharing of IP, and there will also be a contract signed to talk about timeline cost of the solution when this is being so-called developed eventually. So in this case, unlike the first one is actually subject to open tenders, even though you have been identified, because there are already solutions out in the market. But of course, by going through the process, you have a higher chance because your solution has went through the proof of value, right? But the second one actually called for collaboration because of the extensive customization, where IP are being signed. So this one is, there will not be a tender requirement. You go direct, where you will be identified as only solution provider.
We only have 1 system, and every day looks the same. So I lost my like inbuilt calendar because every day starts.
Okay, yes. So how to register? So we need to first register for the virtual presentation program, which I mentioned earlier. And then that will allow you to participate in the 2 virtual presentation. The first one, sorry, it's not the 6th of May, it should be the 13th of May. 6th of May will be the so-called this sign up, but on the 13th of May will be the sharing by the healthcare provider. And then on the 6th to 17th of May, and that's where you will come in to present to the healthcare provider. Okay. And then once I mentioned, when you clear the virtual presentation program, then we'll go through another round of shortlisting by the healthcare provider for the physical market visit. and that's where a 20,000 kronos fee will be required. Does not include travel and accommodation, but you include group lunch and transport to the site. Okay, so just want to remind everyone, the virtual presentation, we can only take in at the max of 30 companies because we only have 10 working days to do the presentation. There will be only 3 companies presenting in a day. So you can imagine you will gain a lot of attention. You'll be given quite sufficient time for you to do a proper presentation. So what we get out of this program? Firstly, I want to emphasize this is not a ticket to a PO. There will be a request from, if there's a request from the hospital, there will still be an open tender as required. Unless you are going for the call for collaboration, then in that case, it's a different pathway, a different contract will be signed, right? But this is a great opportunity for you to network and connect with a key user. And this is the first time I believe we have engaged all the nurses in Singapore. And I literally say it is all the nurses, or I'll qualify all the public healthcare nurses in Singapore, because we have reached out to the group nursing, which are responsible for all the nursing team within the healthcare system in Singapore. And then you definitely have the opportunity to present directly to the hospital, to clusters, and also to on the national level in a single sitting. And you will receive market intelligence from us and to help and guide you through the whole process, so that will increase your chances of success. So next, I would like to go through the form. It's important for you to fill in this form accurately. So this form will be sent out to you. If you don't receive it, then you can still go to your TPO office to request them for the Word version. First, of course, fill in your company name, which country you're from, your website, a contact person, destination, and email, quite straightforward, and the product. So if you have more than one product, you can then fill in more than one form, or you find that you can actually put them into the same form, you can also go ahead. But if you have more than one product, if they are of a different kind of category or different nature, I would suggest that you fill in more than one form. So it's important. I've spent a lot of time going through the focus area just now. So this is very important because we will tabulate this and we will actually then share it with the nurses for them to select which are the companies they are interested in. Then you can be then selected for the pitching session, right? So this is a list of all the areas which I have shared just now. So please tick accordingly if you have fulfilled or your solution fulfilled one or many of these. But for some of you, if you find that none of them apply to you, but you are sure that your product still improve nursing productivity and patient safety, then please tick this and then explain, right? So for the rest, although you have identified that you fulfill the certain key areas, you still need to justify actually how do you actually fulfill the area, right? Then provide us with a simple, short description of the proposed solution, not too lengthy. You can imagine that the nurses will have to read through many of these documents. So due to their limited time, we need to be very precise and targeted. So again, I will hope all the various TPO office can come in to help the respective company to review this document so that you can be more effective. And just now, earlier I mentioned nursing productivity is very important. If you can kind of estimate the amount of saving in terms of or the percentage of productivity gain, then that will be a good guideline. So we are not actually holding you responsible for this number, but we want to have a gauge based on your past experience in implementation in other sites. How much productivity gain has those your previous customers experienced? Then put in a number here. So other than in percentage, you could also identify in terms of manpower, in terms of a headcount saving. So one example I mentioned earlier, let's say pushing a bed, instead of using 2 staff to push a bed, maybe you say now I only need to use 1 staff to push the bed. to transport patient from point to point, then of course you have one headcount saving there. And of course, how to some other criteria will be, does it improve patient experience and safety? If yes, it will be a good plus point. So number 6, how mature is your solution? Has it cleared CE and FDA? Is it not required? Or maybe it's pending CE or FDA certification? Or is it in an R&D or prototyping stage? So just tick accordingly. So there are other solutions in the market that could be similar to yours. So if there is, please list it out here, and then this identify why you are what are the advantages over this other solution in the market. So you need to be aware that the nurses are probably exposed not just to NORDIC companies, they are exposed to a lot of other solution providers knocking on the door every day. So they are familiar with such other products as well. So if you have information on that, it will be good to share. So some systems actually require extensive infrastructure when you want to implement. It could be electricity, could be gas, could be other building requirements. So if your system requires that, please identify as well, because that will then get them prepared to check with the respective other departments, be it the facility department, the IT, or be other departments, to ensure that they have the infrastructure requirement to implement your solution. Implementation cost of ownership. So here we are talking the total cost of ownership. So I understand some of you might be sensitive to talk about the product pricing, but why we want to share this information here is to let the nurses know that this is something that is affordable, right? No point sharing them with some very good solution, but it's something that they could not afford. So one good way to share this is actually to talk about what is the cost per use or cost per patient day, or what kind of cost saving that do you have when you use your solution. Because sometimes if you save manpower, of course, there's cost saving, right? And this information are not shared among the companies. These are shared only the TPO office and the nurses. So these are information that we will not disclose to any of your competitors or any other companies. So this will be kept among ourselves. But if you choose not to put in this information, then, well, we'll leave it to you to make that judgment call. Lastly, okay, I think sometimes a picture or video tells 1,000 words. So if you have, or if you like to create a short video of about 5 minutes, and I think that will be more effective to help the nurses understand how your solution works, okay? So this video is not about introduction of your company. It is about your product, what benefits, how to use it, anything that can be better kind of shown over a video, that would be most ideal. So this video is important because that could gain a lot of attention, because at this stage of submitting this form, you have not been shortlisted yet, okay? So it's important, or it'll be a very good plus point if you can have a video. So provide us the URL link to this video so that the nurses can go in and watch the video. Questions on the form? Okay, registration closed on the 6th of May at CET 9 a.m. Please email to your respective TPO office rep. So for Innovation Norway, it will be me. For Business Sweden, it's Nicholas. And then for Business Finland, it will be Arrow. Okay. Anyway, the email will be sent out to you with the form in a Word document, so they can kind of key in using the Word apps. And then we also list out these 3 contacts for you as well. Oops. So I'm pretty surprised that after I speak so much, there's no question at all. So I hope you guys are still. So does anybody has any questions or anything that the TPO office reps want to chip in to add on? Sven, you have something to ask?
Yes, well, thank you, Nico. I think it was quite well explained and easy to understand. So I don't really have any questions apart from, will you share the presentation with us afterwards? And I don't think I have received the application form, but I
The
probably
application
have.
form will be sent to you after this meeting. Yeah, that's
Okay,
why
I
I
see.
was trying to take attendance to see who has attended. Then only those who has attended will be receiving the application form.
I see.
Yeah.
Okay, thank you. But
as for the slides, I will be sharing the slides, but some of the information will be taken out. That means I will share a shorter deck of slides rather than the complete slide.
Yeah.
Yeah.
Great.
But in any case, although it's Q&A now, but if any of you find that there's still other questions that if you would like to ask, you can email to me or email to your TPO office. Okay, so that then we can follow up on any of your questions. So good. So I think like what Sven said, it's probably the slides are so comprehensive that there's no question at all. Hopefully I didn't confuse everyone. So okay, good. So remember the sign up time, it will be 6th of May. So remember to log down that date and make sure you can send us anytime. And I will strongly advise you to prepare early and then send it to your TPO office for inputs, right? We would like to really help you to improve on your write-up so that it can be more targeted, that we can help you to focus on what are the key points that the nurses could be looking at. Sometimes it's not that your product is no good, but just that the information that the nurses need to see or need to understand might not be clearly listed there. Okay, if no questions, then we will end this session. Thank you everybody for your attention. Have a nice day.
you.
Bye.
Bye-bye.